Good morning, everyone. My name is Sumitra, and I'm working as Assistant Professor in the Department of Biotechnology, Chaitanya Bharati Institute of Technology, Hyderabad. Today, I consider it my privilege to introduce the speaker for this 1-week webinar cum FDP series. So firstly, I would like to introduce our speaker, Mr. Muthu Singaram. Mr. Muthu Singaram is a parallel entrepreneur having been involved in several startups over the last 20 years. Sir has over 25 years of experience in engineering, management and entrepreneurship. Sir has been a judge and mentor in many business plan competitions including IIMs, IITs, Power of Ideas, HSBC Business Plan competition. So Mr. Muthu has MBA in Multimedia Finance, and Sir's passion is in entrepreneurial development, mentoring, management of emerging technologies and innovation. Sir was responsible in developing the Malaysian National Unipreneur Development Program at the Multimedia Development Corporation. Sir is also a council member for the National Incubator Network. Sir has mentored, consulted and facilitated participants from many parts of the world, and these include companies like British Telecom, Institute of Public Administration Malaysia, etc. Well, the National Productivity Corporation, Malaysian International Chamber of Commerce and Industry has recognized Sir's effort, and he has been a visiting faculty or adjunct faculty member, professor at several universities in Malaysia and India. And in India, Sir has been invited to various universities like Anna University Madras, in India National Institute of Design Ahmedabad, etc., and many other prestigious institutions. Sir was the project director at the British Telecom at their Asian Research Centre. In a span of 16 months, the team filed 10 patents and 16 publications. One of Sir's project, ODR World, an online dispute resolution service, was a provider at eBay, India. Currently, Sir is working on a virtual international business accelerator, aka Viber Zone, based in several locations. Sir's recent major consulting assignment is for the Malaysian government agency under the Prime Minister's office on industry-driven innovation, helping research and entrepreneurs. Sir is also mentored and he's authored 2 books. The first one being Entrepreneurship, a hands-on guide to starting your business, and Green Fields is the second one, which is suggested standard operating procedures for incubators. Sir, it's a privilege for all of us to be listening to your thoughts and experiences, because we rarely get this kind of an opportunity to listen to the words of this great personality. Thank you, Muthu sir, for accepting our invitation, and I request you to begin the session. Thank you.
Good morning, everyone. Thank you for the opportunities to the organizers for giving us the opportunity to present this morning. I've just put on my presentation. Archana, can you see my presentation?
Yes, sir, I could see your presentation.
Okay, so let's get started. The topic we are going to cover today is called Role of Startups During the Pandemic and the Future. So we'll take you through the next 35 minutes, 40 minutes on what we are going to talk about. First thing, as always, we like to do is for you to write down what would you like to achieve in our session. So you've made your time worthy of spending with us this morning. We'll give you 30 seconds, so I'm going to keep quiet for 30 seconds. Okay, keep that for yourself. You don't need to share that with anybody. It's just for you to see whether you achieved your goal. So we're going to start off with the first slide here. What has the pandemic done? Firstly, doctors have started doing telemedicine because many people are not comfortable leaving their house. So as such, Doctors have started doing telemedicines, and telemedicine applications are booming at the moment. Doctors have started using, hospitals have started using more electronic medical records because this gives the chance for people not to carry paper and so on, so it becomes paperless. So it's useful for going from one doctor to another. And it's also become human touch and connections have reduced because we are now working on online telemedicine and so on. So therefore, we need to be very, very cautious on what we create, that there's some human elements to the healthcare. Next thing, triaging. Triaging now has become important. The hospitals and doctors have to decide which patients will be treated first. So there are three categories. The first category is whatever you do, the patient is going to not recover. Second, you don't have to do anything and the patient will recover. And the third option is where triage will have to work. The patient has a chance of recovery by doing something. So this is not necessarily the youngest patient or the oldest patient, it's the patient with the best chance of survival. So triaging has become important. And recently, in one of my interaction with the hospital in Bombay, they said they've told that the young doctors that triaging will be a hospital decision and not a doctor's decision. So the doctor does not have to feel uncomfortable making those decisions. He just has to make the decision, believing it is for the hospital's decision. Public health has never been in forefront as much as it's today after the pandemic. Public health has become an important role. It's going to open up venues. Lots of opportunities in public health is going to happen. Today, companies are willing to share information, particularly drugs, protective gear, and so on. Our hospital occupancy today is only 30%, so hospitals are struggling as well to keep it going because there's a lot of still cost to run a hospital. We need to now do psychosocial counseling to make people feel comfortable in sense of how to deal with epidemic, how to go to hospitals and so on. And we have started doing social isolation. As I was listening to a conference just a few days back, it said it's social distancing doesn't mean social isolation. So we can still talk on online like what we're doing today. We can still meet people online. So we don't have to close off our social circles. We just have to physically isolate ourselves to ensure that the pandemic doesn't, the virus doesn't spread to others. Now, as I said in the last slide, four companies recently were given loyalty-free license to make this drug for 127 countries, which would have never happened in the past. So this is a royalty free. So for these companies can make this drug and distribute them for the good to help during the pandemic. Now, what would be the future of after the pandemic? Car parks in many of these hospitals are going to become waiting areas. Why? Because it's safer to wait in the car park than crowd the hospital. So the patient will most likely wait in his car park and wait for his turn to be called, and he'll probably get a phone call or an SMS saying it's your turn to come. Many of us are going to go to the hospital less. It's going to become less hospital centric. Virtual care and telemedicine is going to become very, very important. Like for me, I even used to do it years ago when I had dengue. I called back my physician back home and he was treating me over the phone. But then it was not something people are comfortable with. So I was okay with that. I had him giving me advice and I used the local labs to do my blood test for the entire period of my dengue episode. I never actually got admitted. I stayed at home and took his advice and went to the lab in the morning and the evening to get my platelet counts on a regular basis to ensure that my platelet counts were not going into danger levels. So some of us are used to that, some of us are not used to that. So a lot of us have to get staff to do that. Higher privacy needs to relax. The data sharing will have to become a little bit more instead of being worried about so much about privacy. So we need to work on that too. And health bots are going to be very useful. They're going to be able to help doctors, help patients with especially e-consulting, particularly for specialists, is going to become very important. All these things will only work if there's an economic model. If there's no economic model, who's going to pay for all these services? So we need to work out a, a very, very workable, affordable economic models. And a lot of people are going to do self-care. So that's also going to be quite important, where people are going to take care of themselves. And we need to start depending on sensors and devices because they can help and monitor us better, the information can be transmitted to our physician. We need to see how we can enhance human contact. We also need to have better instructions written for use of technology. Many of the technology do not have good manuals, so that has to be worked on. Data has to become interoperable so people can use data from multiple platforms to ensure there is continuity, there's usefulness on the data. So this is going to be the future after the pandemic. Now, continuing with the future after the pandemic, what would be exciting? Having modular, flexible, and having speed, a CT scan in a box. Speed is important. Flexibility is important. We need module. You could have a CT scan in a little box where it could help us. I mean, this is futuristic things which startups can look at. We need to be collaborating more. This is going to be a big word. Many of us are going to start collaborating. Lots and lots and lots of us are going to collaborate because that is the way forward from now. So the pandemic hasn't been all bad. It has started making people connect better. We need different skills. We forget the number of technicians have been running around, keeping all that equipment in the hospitals during this pandemic running. We only talk about nurses, we talk about doctors, police, others, but we never talk about the poor technicians who are running around the country, around the world, keeping this equipment running. They are servicing them, they're ensuring they work well. So we need to have lots of different skills coming into. Productivity must go up and the cost must come down. And that's where a startup will get in, bringing costs down, but productivity must increase. Patients will go for tests before doctor's appointment. For example, if you're having urinary infection, you have certain symptoms where you regularly keep going to the toilet, you have a sort of a stingy sensation, it's sort of heading towards that. So you could possibly do your blood test before going to see your doctor. So when you go and see your doctor, he would have your urine readings, you'd have your blood readings, so you don't have to go back the second time. At least when you go with all these readings. So all this is going to be changing the world of health. Now, networks plus speed is important because we talked about doing telemedicine. If the network is not there, the speed is not there, we will not be able to achieve these things. Network security is like health security. We only know when there is a breach. So we can learn a lot from our friends who do network security, how they tend to keep their security on the network. So health security can learn. We also need to learn about contact tracing. So we know where people are, what they've been doing. So these are our futures of the pandemic. Now, this is a recent report which shows that 14% of companies have improved both in growth and margins. So not everyone has struggled. For example, healthcare, consumer suppliers, and mostly telephone operators, they would have all benefited because we are all using online facility like today. So all this costs money. So this is the data from BCG just about a month back. So you can see there are people who have grown during this time. Of course, others have also shrunk about 44%, but that's quite normal where the shrinking is. Now, what is machine learning? Machine learning involves artificial intelligence, which enables the system to learn through a human expert who will automatically, through his experience, build these algorithms, which will actually help diagnose the new person, that is the patient who's coming in. So all this happens through machine learning. So instead of the system looks into a database, it actually learns from what it has within the system to provide a solution. This enables the system to provide solutions to problems identified and recognizes the pattern. So for example, tiny spots on an X-ray. The system will try and interpret what these tiny spots are to help the doctor make better decisions. It helps them learn through provided inputs and commands. And therefore, the person who's teaching this uh, algorithm will need to be an expert themselves. The algorithm is going to be as good as what the input is. So it's important to make sure the input is extremely well taken care of. With this, support providers from machine learning organizations will be able to work more efficiently and produce revolutionary. This can happen in manufacturing, it can happen retail, in particular healthcare. Healthcare is going to play a big role as we go into post pandemic. It can work in oil and gas, financial predictions, and so on. So AI and machine learning, they are here to stay. Now, trust areas which startups can explore right now. Of course, protective gear, very important equipment which we require. They are very expensive. The startups can come with alternatives which are more affordable. It will help patients. Masks, of course, ventilators. If we can produce affordable ventilators where multiple patients can be used, but there's always need to be careful. The ventilator is using by multiple patients at the same time. Each patient will require different parameters. So we need to be able to have an intelligence built in between. So each patient gets what it requires and not a standard ventilator going on. Synthesizer are also important. We need to have them made. Vaccine and drug discovery is becoming very important. Lots of funding going into that. So that's an area. It's costly, but it's very, very important to do. And the last one is test kits. We need to have rapid test kits so we can find out who has been infected, so treatment can start, isolation can start. All that would help us. Now, general procedure of an AI and non-AI based application that helps. Let's take an example right now for COVID-19. So if it's AI based, the physician identifies possible matches of COVID symptoms with the help of the AI. So then he takes samples, he gets the patient quarantine, he looks at the AI to treat and monitor when we get into recovery phase, and then retest for coronary. Positive is still isolate, negative we cure. You see the number of steps, the less if you're using an AI. There's a conventional physician analyzes symptom, he decides if multiple matches found, if no multiple matches found, no test taken. So with the AI, we will not have that issue. We will not make those, hopefully not fall out in that area. Then you test the samples taken, the patient is quarantined, if it's symptomatic, is treated, recovery phase, retest for COVID, it's the same the last two steps. It's positive, you isolate, negative, you cure. So it's important to have this to help the physician make the right decision so we don't have any false um, readings coming on negative or positive. Very, very important. My colleague now will take you through these next few slides. Archana is going to talk you through the next 4 or 5 slides. Over to you, Archana.
Hello everybody, I'm Archana. First of all, I would like to thank our CEO, Mr. Muthu sir, for giving me this opportunity. Now, to look into the applications of AI, AI has vast application in different sectors of healthcare. Say for the research and development sector, AI could be very helpful in fastening the drug discovery and its development since it has a lot of existing data sets in its cloud. So this will be very helpful in diagnosing and discovering the drugs and its development. In regulatory compliance management, AI would be helpful in complying various information. So this will in turn will increase the quality of the product and its operation support. AI will be very helpful in market intelligence. It will be very helpful in creating and collecting data very in accurate manner. So this might pose any threats and opportunities to the scientists in various decision-making aspects. It will be very helpful in scientific information management, thus providing results in a very reliable manner. Thus, this will reduce your knowledge retrieval and your search productivity. It will also has vast experience and usage in robotic automation. This AI will help the bots in finding out data from the complex documents, thus automating the complete internal workflow of a system. Next slide, sir. Yes, there is various applications of AI in healthcare. So artificial intelligence and machine learning has vast applications now booming up in the healthcare sector. Right, say for the identification of diseases and its diagnosis, in drug discovery and its manufacturing. AI also has various applications in biomedical imaging diagnosis as well. Now, various customized treatments and medicines has been coming up. So AI has a very good vast application in that too. And in machine learning based modification system, AI is also being used. And in maintaining smart e-health records. So we have been like a traditional system, we'll be using a large amount of paper reports from our hospitals. So maintaining a e-health record is even more convenient nowadays for many patients and also from the hospital system. AI can also be helpful in many clinical research and in trials, in various data collection aspects, and in radiotherapy and in radiology. With large number of complex data storage and a database setup, AI can also be helpful in predicting an outbreak in future. It also has a very good application in robotic surgeries as well. So, yes, there are a lot of companies that have been facing challenges recent time. Even startup, even or big companies, AI can be very helpful in overcoming these challenges faced by the companies. For example, uncertainty in its demand and supply. AI can be helpful in fastening the decision-making aspect of a company in updating forecast in real time. So, with an example, we can say in a digital control towers and in decision support platforms and tools, AI can be very helpful. In any disruption in supply and operations, AI can be helpful in flexibly allocating the resources and in improving the cost efficiency of the product. It can be used in chain optimization, value chain optimization in real time. As the challenges in the workforce allocation, AI can be very helpful in optimizing the remote offerings and in reallocating the workforces. Hence, this can be used in labor allocation as well. Since there's a lot of dynamics in the consumer priorities and in confidence, since the sector has been changing a lot, AI can be very helpful in giving a rapid response to the new changes and the new behaviors in the system. Thus, this can be helpful in customizing the product in the real time. Next slide, sir. Yes, there are a lot of benefits of artificial intelligence in healthcare. The main benefit is it can provide results in a very high quality manner. So this will have a proper and better hospital management system. A lot of teleconsulting services has now been coming up during this pandemic, since AI has been a very assistive tool for the doctors and patients during this pandemic. And with this AI, we can have a maximum number of error reduction in the results and in the delivery system. Since many manual error can be reduced, this can also be used for various applications in healthcare. So this will reduce many manual activities. Since the process has been automated, so this will reduce the manual activities from the hospitals in the patient care system. And also with AI, we can extract data very precisely and very accurately. So since there is no human intervention, this can be extracted very in a precise manner. And this can be used for patients who need very proper and continuous monitoring outside the hospital system. So in the base of their home, they can able to have a good proper hospital and patient management. And AI can also be helpful in analyzing the risk and threats that can be overcome and that can be occur in a system. Hence, AI can also be used to store a large number of data, a large number of complex data on its cloud. Thus, the healthcare system is very secure using an AI. Thank you, sir. Thank you so much for giving this opportunity. Over to you, sir.
Thank you, Archana. Well done. It was her maiden's presentation. You've done very well. Very good. Now, let's continue with the next slide. Other use cases, examples of AI in the post-crisis world. Advanced robots are going to be important. For example, even now, if robots can go in, operate in machines in the factories, they can act as nurses, so there is no less contact of the patient to the nurse. At the same time, there's somebody sort of coming to you, so there's still some elements of contact there, so the patient also feels comfortable. AI-enabled platforms to help companies better simulate life work environments and create on-demand labor force. So with a platform like this, they can always create demand for work and so on. Detection of new consumer behaviors, especially hyper-personalized. So you know what your customers are using in terms of products, services. So you'll be able to give them better products and so on and reach them out. Learning underlying patterns enables computer systems to make complex decisions. It predicts human behavior and recognizes image and human speech, among many other things. So AI can help not only in healthcare, even in consumer behavior, by understanding, learning, and then giving you a prediction what your customer wants. So all this is important. Now, COVID-19 crisis is accelerating the shift to new reality. New reality, first of all, is uncertainty. It requires redundancy, which inevitably means increase in cost. because it's uncertain, so your cost will go up. For example, flying is going to be more expensive because they will be carrying less passengers, so their cost will be high. Secondly, less people are going to fly, so there's going to be again extra. So how can AI help in that case? AI enables the greater skills and scope needed to build redundancy while minimizing your cost. So AI will give you prediction. So instead of running 4 flights to Chennai to Delhi, you might run 3 because you now have less capacity. So you're actually saving money by only flying 3 flights. So all this is helpful from using AI. Next one, consumer patterns are moving towards e-commerce and other digital models. Consumers may increasingly distinguish essential from luxury items. So that's again very, very important. AI will help you to detect these patterns of consumers and it will allow you to say to the consumer, you bought this last week, maybe you like to buy this, and maybe you like to buy this next month. So it starts to give a hyper-personalization. AI can improve R&D, innovation, and new product development, obviously, because you get lots of data coming in, lots of intelligence in there. So you start to be more productive. Remote ways of working are becoming the new norm. On-demand labor is becoming more important. Of course, all this to do with cost. So AI-based companies are equipped for new ways of working. So they have already learned how to work from remote areas. It will also enable them on-demand labor through more precise sales and supply prediction. So as you go, you can get more labor. As you get less order, you can have less labor. So AI will be able to give you the prediction. So during a peak period, you may need 10 people. At a low period, you might need only 3 or 4. So this helps you predict, keep the cost down, make it more effective, makes it more manageable. So this is really the new reality. Now, what is there for startups to do? Rapid test kits are definitely going to be of great value. Contact applications, because you need to find where these people are, where have they gone, where they come from. So it's important to have contact applications in place. We'll also need to have contactless devices. For example, the doctor's stethoscope is now touching a patient. So the next patient might be a little concerned of getting something out of it. So even my conversation with some doctors have said medicine is going to be different now. There has to be less contactless devices. So these less contactless devices have opportunities. So you may want to think how you would ensure these contactless devices can be brought into the day-to-day applications. Now, 5 principles for building a human-powered AI company. First of all, we need leadership on board. The top management must be keen. Several months ago, if you said we will do this seminar online, nobody would have been interested or keen. Today, there's few hundred people watching this seminar, which we would have never been able to do together at a face-to-face. Maximum would have had 500 people. Today, we can have more than 500 people because everyone doesn't have to travel. So cost becomes cheaper. You don't have to provide tea, coffee, lunch. So cost becomes cheaper. So you got to encourage leadership to come on board to build a case for it. So this is again similar to what we are doing today. AI will need to do that. You need to reimagine the organization with AI as its core activity, transforming the human-powered AI company. As artificial intelligence, it says artificial. You cannot go away with the natural intelligence. You still need both of them working together. You need to contain or discard legacy processes. You need to prepare people for the change. We'll need to understand that AI is here to help us, not to take our jobs away. It helps us to do better with our work. As we've been talking about, it reduces error. It helps in mundane jobs where the AI would not make a mistake, but humans would make a mistake because we are easily get tired, fatigued, bored, and we make errors. Machines don't get into that. So you have that advantage. Now, try and AI applications in the health sector. We're just going to run through some of these companies. Smart Recording is spoken by my colleague just now. These are the 3 companies working on smart recording. So they try to reduce cost of recording medical data by optimizing its regular operation. So we're not going to go through in detail of each company, but it's just to give you an idea what is happening out there. Medical imaging and diagnostics is another area which is very, very important. As you can see, some of these people have raised good money to do what they're doing. Microsoft is working in it, Quantum Insights are working in it, Patai is working in it. So there's lots and lots of activities happening in this medical imaging and diagnostic. Huge opportunity for us. Drug discovery and development, of course, people like Pfizer, Bio, Bio Biosystems, MedTech, and Instituto all are working on drug discovery. Drug discovery is always cost effective. It's very expensive. So AI could help us reduce that cost possibly, and to help us do our innovation and R&D throughout using AI. So these are some other companies working on these areas. Medical data, treatment and prediction of disease is another important area. These companies are working on that. So you can see many of them are based out of the US. We also have Indian companies who are working out of, in some of these areas. And these are working on startups which are using AI. So you got Advanced Cells. They are working at high medical standards to deliver regenerative medicine, which delivers treatment options to patients. And then you have Atlas and few others who were startups are working using this to detect diabetic and so on. So we have that Pune-based startup, which is founded in 2014, delivering online reports to patients, including online payments. So you have Indian companies also in this area. We're continuing to see there are more startups here using. As I had said, it is not my interest to go through these companies, but just to tell you, there are lots and lots of companies working in this area. Now, I'd like to share this with most of you who are planning to do startups. The biggest communication problem is that we don't listen to understand. We listen to reply, and that's often not a solution for a startup. We should listen to solve problems. That's very, very important. Now, what is next? Identify your key takeaway from this lecture. What have you learned? Even it's one thing. How does it relate to you? And how are you going to share this with others? When you share with others, it travels and we get better and better. And so it's important for all of us to be able to share what we have. So that's that. And that brings the lecture to a conclusion. You can always reach out to me using my email, muthu.singaram@vibrazone.com. My telephone number is 9790932420. You can pick up some of the books we have in Amazon if you key my name in, and we have a YouTube channel which I on a regular basis upload activities on innovation, incubation, and so on. So please do visit the channel and do give us your feedback. Happy to come visit any of your centers at any time it's possible, because we are extremely passionate about incubation, innovation, entrepreneurship, and startups. We've been doing this for over 25 years, so we continue to promote this around the world. We'll be happy and delighted to help you with your journey in these areas. I'd like to thank the organizers once again for giving us this opportunity to present to you this morning. And I would like to say thank you to my co-presenter, Archana, for doing her maiden speech. I think she's done incredibly well this morning, and she will continue to learn to do that. So we thank you for that. And please reach out to us at any time you want to reach out to us.
I would like to thank Mr. Muthu Singaram sir for accepting our invitation and being a part of this 1 week webinar cum FDP series and delivering such a wonderful lecture. And I'm sure that participants have thoroughly enjoyed this session, and it must have been a thorough learning experience for everyone. I have thoroughly enjoyed this learning experience by listening to you, sir. Thank you very much, sir. Thank you.